We have a number of questions that come up, but I wonder if we should choose perhaps taking out the first one there. Do health economic models account for side effects of wrong diagnosis? Just say a word on that, Katherine.
Yes, but badly. I think we need to make more efforts to improve the methods we use. We need the evidence base to understand what's the impact of a wrong diagnosis and to be able to measure that.
And I think there's a question here about trial designs and research, and we had a lot of discussion this morning about research and the ways it has to change here. I wonder, Michael, do you have some thoughts on how we incorporate the research that cannot be done in the conventional ways into the whole process of either adopting or not adopting drugs? And how,
Yeah, I mean, and I was talking to Carl about this in the basket trials for larotrectinib. I think the main message I would say is that there needs to be earlier engagement with the health economics community. Frequently what happens is people go through all this fancy research, and it's all lovely, and they then have high-cost drugs, and then they suddenly decide, oh God, someone has to pay for it. And that's when we first hear about it. So I think it's got to happen earlier, because there are certain things in trials that we would like to have. I mean, I still can't believe that people are doing clinical trials and they're not gathering quality of life data. It's pretty basic stuff. So I think there has to be an earlier dialogue. I welcome this meeting because it's one of the few meetings that has actually discussed topics like this and actually include health economics.
Yes, I think one of the things that's coming out of all of this discussion, I think, is that we really need a new model for how we finance the research and development for new drugs. At the moment, we do it on the basis of high prices being allowed on a pretty arbitrary sort of basis. And instead of having some sort of certainty about people getting access to things that are useful, even if they're not useful at the price. But the cost and the price are often so different from each other.
That's right.
So we perhaps have one final thought. So what are the gaps in the research area of cost effectiveness in precision medicine? We only have 2 hours to answer that, but would each of you like to say what your first preference would be?
Shall I go first? So I think I'm not saying let's discount the cost effectiveness analysis because that's important in the HTA context, but I think we need to start thinking about some of the implementation issues. So thinking about if something is looking cost effective, how then do we set up a model of service delivery that makes sure the patients and the clinicians can access it in a way that's usable? That is also an economic question, I believe.
Michael, you're...
Yeah, I'd go along with that, and I think a lot of the other points were made during the presentation. Yeah.
Okay, well, thanks very much to both of you. The exam question I set recently to some unsuspecting dental students was the only 2 problems in economic evaluation: measuring costs and measuring benefits. And I think that's come out fairly clearly from this. Thanks again to our 2 speakers today. Just before you have your rapturous round of applause, lunch is served opposite the entrance to the conference area here. You will be back here at 2:30. You will not be back here after 2:30. And so if you can make sure you're able to restart. Otherwise, we'll be going into overtime at the end of the meeting, and that's not acceptable. So thanks again to our friends.